So welcome to the Bury and Rochdale Local Care Organisation. My name is Susannah Rowles and I'm one of the consultants mainly based at Fairfield, and I'm a diabetologist, an endocrinologist and a general physician. So that basically means I do sugar, hormones and a bit of everything else. I suppose in my school holidays I needed to earn money, so I worked in a care home and I was surprised. I loved it. I was part of a team. The residents were really interesting. They were old. If you had the time to listen to them, the stories they could tell you were absolutely fascinating. So I enjoyed that. I've got a cousin who's pretty mentally handicapped, and she taught me a lot. She taught me people are different and you appreciate their differences. So medicine seemed like quite a good option. I love doing the transition clinics. So that's basically for young people between 14 and 19 who have type 1 diabetes. I do that in conjunction with a paediatrician and other members of the team. And I'm not a parent myself. I can just sit there as hopefully a resource of some information, offer a bit of challenge, often challenge to the parents, saying, you just get off the back a little bit, or to be able to offer some new technologies, or to help smooth that pathway. Adolescence is pretty difficult. It's even more difficult if you've got to make about 200 extra decisions per day. Do I prick my finger? Do I act on that sugar? What do I eat? It's really tricky. So to be allowed time with my transition patients, I value. I look forward to that clinic. Our team's big. It's made up of diabetes specialist nurses, specialist dietitians, podiatrists. We have doctor trainees as well. We have GP trainees, and we all tend to just muck in together. And it's very much patient focused. We say to the patient, which particular area of the expertise do you want to tap into at any one time? So sometimes it can be me leading the clinic, sometimes it's the diabetes nurse. We've recruited colleagues. The consultant base has increased within Fairfield, and that's a big plus. The other thing is we're a very busy DGH, District General Hospital, and when you look at our data, although we're small, the acuity of patients that are coming in is really quite high. And although at the moment we're in the middle of winter pressures, we're managing. What's good is the team always just pulls together. There's no sense of a front end A&E and a back end that are the wards. One of the best things is it is a seamless service, and if one end feels the pressure's shared, and I value that. At a consultant level, we're lucky. All our offices are based in one area. So if I turn left out of my office, I can get a neurology opinion. On the right, I've got gastro, a little bit further up, care of the elderly. Round the corner, I can get a respiratory opinion. So there's very much an old-fashioned camaraderie in many ways, which can get you quick answers and mutual learning as well. And if you need a second opinion or you just want to bounce ideas off people, it's easy to do that here. There's a camaraderie that's very welcoming. Within diabetes and endocrinology, we're pretty flexible as well. So if someone comes with a particular skill set or particular interest, and there's a patient need for that, we can easily flex around there. So for example, insulin pumps are relatively new. If someone has a burning desire around insulin pumps, antenatal services, andrology services, we're quite flexible to those needs. We have quite a lot of colleagues who were less than full time as well. Most of us still do general medicine, and that does involve an on-call. The on-call rota's pretty reasonable, and that's actually looking to change in the future as well. So it may be more of a fixed shift. So the one thing is that the hard work is very much evenly shared, and I think that's important. I'll probably say sniff and see. Come, just come and have a look. Talk to patients that come here, talk to staff that work here, and people seem to pick up very quickly that there's very much a family feel. So even on a day where it's a bit grim, it's very busy, you'll find people pull together